1. In manual muscle testing, which principle of adult learning ensures that learners connect new evaluation techniques to their prior clinical experiences? A. Motivation. B. Relevance. C. Memorization. D. Standardization. 2. When evaluating the effectiveness of an MMT training program, which method best assesses long-term retention? A. Immediate post-test scores. E. Learner self-reports. C. Observed clinical performance weeks later. D. Attendance records. 3. In curriculum development for MMT, conducting a needs assessment primarily helps to A. Establish budgets. E. Identify knowledge and skill gaps. C. Create marketing strategies. D. Select testing equipment. 4. Which communication strategy is most effective when teaching MMT techniques to a diverse group of adult learners? A. Extensive theoretical lectures. B. Peer-reviewed journal handouts. C. Demonstrations with guided practice. D. Memorization drills. 5. A regulatory requirement mandates documentation of competency in MMT. Which compliance strategy best ensures adherence? A. Verbal confirmation. B. Informal peer checks. C. Structured skill assessments. D. Optional surveys. 6. Mentoring a new clinician in MMT should focus primarily on A. Reducing training time. B. Modeling proper evaluation techniques. C. Sharing administrative responsibilities. D. Assigning independent reading. 7. When measuring muscle strength reliability in MMT, the evaluator should prioritize A. Subjective impressions. B. Inter-rater consistency. C. Patient expectations. D. Randomized practice. 8. An instructor uses case studies to illustrate variations in MMT results. This aligns most closely with which adult learning principle? A. Practice and feedback. B. Experiential learning. C. Memorization. D. Authority compliance. 9. During MMT curriculum design, which element is essential for aligning with professional standards? A. Learner entertainment. E. Accreditation requirements. C. Cost minimization. D. Use of outdated texts. 10. To improve communication in MMT feedback sessions, instructors should A. Avoid discussing weaknesses. B. Provide constructive specific guidance. C. Focus solely on errors. D. Use technical jargon consistently. 11. Which evaluation method best measures both knowledge and performance in MMT training? A. Multiple choice exams. E. Video demonstrations. C. Objective structured clinical examinations, OSCEs. D. Attendance tracking. 12. When mentoring, why is guided practice in MMT critical? A. It minimizes patient risk. B. It eliminates documentation needs. C. It ensures learners memorize content. D. It reduces instructor workload. 13. A trainer requires learners to verbalize each step during MMT practice. This technique supports A. Reflective learning. B. Regulatory compliance. C. Time efficiency. D. Minimization of errors. 14. In adult learning, feedback during MMT skill acquisition should be A. Immediate and specific. B. Delayed and general. C. Avoided unless errors are severe. D. Provided only at the end. 15. Which regulatory compliance issue arises if MMT is documented inaccurately? A. Increased learner satisfaction. B. Reduced liability. C. Legal and professional consequences. D. Faster patient turnover. 16. Which mentoring approach helps learners internalize MMT principles effectively? A. Allowing mistakes without correction. B. Structured observation with feedback. C. Assigning unrelated tasks. D. Restricting questions. 17. In evaluating MMT training programs, summative assessments primarily measure what? A. Learner engagement. B. Overall achievement of learning outcomes. C. Initial skill levels. D. Future curriculum goals. 18. Which curriculum element ensures progressive development of MMT competency? A. Random skill sequencing. B. Structured learning objectives. C. Informal practice only. D. Minimal assessment. 19. Effective communication in MMT requires instructors to A. Simplify terminology when appropriate. B. Use exclusively technical terms. C. Avoid visual aids. D. Speak quickly to cover more content. 20. When regulatory agencies audit MMT training, they most often request A. Personal notes. B. Formal documentation of competencies. C. Informal testimonials. D. Instructor impressions. 21. Peer mentoring in MMT provides learners with A. Lower training costs. B. Opportunities for guided skill reinforcement. C. Disconnection from standards. D. Sole reliance on written materials. 22. Which principle of adult learning emphasizes self-direction in mastering MMT techniques? A. Extrinsic motivation. B. Passive learning. C. Andragogy. D. Standardization. 23. To evaluate clinical reasoning during MMT, instructors should use A. Written recall tests. B. Realistic case scenarios. C. Attendance monitoring. D. Memorization drills. 24. Curriculum design for MMT must integrate A. Cultural competence in communication. B. Outdated compliance codes. C. Random practice without feedback. D. Minimal learner interaction. 25. In providing feedback during MMT, instructors should A. Use corrective feedback as coaching. B. Ignore positive performance. C. Focus exclusively on written tests. Avoid discussion of results. 26. When teaching MMT, aligning with adult learners' goals ensures A. Higher relevance and motivation. B. Reduced accountability. C. Lower retention. D. Compliance issues. 27. In mentoring for MMT, role modeling demonstrates A. Appropriate technique and professional conduct. E. Theories unrelated to practice. C. Shortcuts to avoid regulation. D. Irrelevant administrative processes. 28. Regulatory compliance in MMT education ensures A. Consistent standards across practitioners. B. Informal flexibility. C. Cost savings. D. Reduced feedback needs. 29. Which evaluation tool best assesses progression in MMT skill acquisition? A. Skill checklists with rating scales. B. Open-ended reflection essays. C. Attendance charts. D. Satisfaction surveys. 30. Adult learners in MMT programs retain knowledge best when they apply concepts in real practice. B. They only memorize content. C. They are restricted from practice. They avoid peer interaction. 31. Which communication technique reduces learner anxiety during MMT practice? A. Supportive reassurance. B. Use of technical jargon. C. Ignoring errors. D. Strict silence. 32. Program evaluation in MMT education should include A. Both formative and summative assessments. B. Only financial outcomes. C. Informal anecdotes. D. Minimal data collection. 33. Mentors guiding MMT practice should prioritize A. Encouraging self-assessment. B. Avoiding correction. C. Reducing observation. D. Limiting practice time. 34. A principle of adult learning that supports effective MMT skill transfer is A. Immediate application. B. Delayed feedback. C. Passive observation. D. Memorization only. 35. Which curriculum strategy supports mastery learning in MMT? A. Sequencing skills from simple to complex. B. Random task assignment. C. Minimal practice time. D. Avoiding assessments. 36. To meet compliance standards, MMT educators must A. Maintain accurate records of learner performance. B. Rely on memory. C. Avoid formal evaluation. D. Use informal notes only.